Good morning, everyone. Thank you for joining Indiana SHIP for Medicare Monday. I'm Susan here in Indianapolis with SHIP, the State Health Insurance Assistance Program, where we help people understand Medicare and all the related insurance products. I am joined by my coworker, Megan Rogers. She's in
Morning.
Northern Indiana. And our special guest today is Jenny Waldon. And Jenny is the Outreach and Enrollment Director for the Indiana Primary Healthcare Association. And Jenny is also a SHIP counselor, and she is a good friend and supporter of SHIP. And we appreciate her time today and every day because you're out there stumping for us too. Um, Now, Jenny's going to talk to us about some really important programs and, ones that are really in the news a lot. And that's Marketplace, the Affordable Care Act option for health insurance benefits for some people, and about Medicaid. So, SHIP does Medicare. We also dabble in some Medicaid for people who are middle and lower income folks. But Jenny's group uh, covers everybody and they can talk to all people about their options. So, Jenny, what can you tell us? Give us the updates on both of those programs and then let us know actually what they are. I'm sure you can do a better job of explaining what they are.
Thanks, Susan. Thanks for having me today. Just a little bit about the my background in the PCA. I am not only a SHIP counselor, I'm an Indiana navigator, which those people work with Medicaid population, and I'm sorry, a certified application submitter for Marketplace, which is as people know as Obamacare. And here at the PCA works with community health centers throughout the state, and we provide training and technical assistance to all the employees of those health centers. And my specialty is outreach enrollment. And people who work in outreach enrollment, they will assist Hoosiers with enrolling in Marketplace, Medicaid, and Medicare, as we call it, the three M's. Um, there is no charge for our services, and we're just here to help guide you through that process. Talking about the Healthy Indiana Plan, that has been a pretty hot conversation. The Healthy Indiana Plan is for individuals who are between the ages of 19 and 64, but have a higher income threshold than traditional Medicaid. Usually those are people who are working um, more like entry level jobs and have a lower income base, but again, higher than traditional Medicaid. Marketplace is for anyone, as long as you don't have access to employer insurance. And we are just getting ready to come off open enrollment. You actually have until January 15th to enroll in a Marketplace plan.
What
Go ahead.
happens about Marketplace? You said you have until January 15th to enroll. What happens if on January 15th you have health insurance through your job, but then in June you lose your job and you don't have insurance? Are you stuck with nothing until the next year?
No, that's what's called a special enrollment, and that's if you've lost access to the insurance you had previously, whether it was through your employer or maybe you were on the Healthy Indiana plan and your income went up above those standards. You would then have 60 days to enroll. There are a lot of regulations now regarding how you can do that. You will have to provide proof that you've enrolled, and they have to approve that proof before they allow that enrollment. So the rules have changed quite a bit, and uh, the best person to talk to is going to be that certified application counselor. You can find those individuals on the healthcare.gov website, and you would just go and click on the portion where it says find local help, and you would want to choose
Yeah, you're freezing up there, Jenny. I think you,
Potentially click on the wrong link and maybe possibly get in touch with an agent or a broker, which they do. They can sell those plans on Marketplace, but just keep in mind that there will be a commission that has to be paid with a certified application counselor. There is no commission. Those people are either volunteers or their employer receives funding to do that work.
right. It sounds like how SHIP works with Medicare and the difference between getting help with your Medicare and with a broker or an insurance agent. Sounds similar.
Right. Very much so. And the really important part about working with those nonprofits or volunteers is having biased opinion. They don't care which plan you choose. They just want to help make sure that they have that you choose or enrolled in the plan that works best for you. Um, Working on, looking at your medications, is your provider and network. They're just there to help you. I do want to point out though that there has been a lot of conversation in the news, a lot about the additional the enhanced advanced premiums that are from the COVID era that expired at the end of the year. Last week, the House did pass um, uh, a bill to reinstate those enhanced premiums. Without those enhanced premiums, according to the Kaiser Family Foundation, people are paying up to 115% more than they did last year. So in turn, this will or has led to a lot of people not choosing to be enrolled in health insurance. And once you don't have, if you've ever not had health insurance, then you know that it really limits your ability to receive care, which can be detrimental. It limits your ability to get medications. But I do want to point out, if you are in that situation, you can work with a navigator or a CAC and or a SHIP counselor if they're inside of a community health center, because community health centers will see you regardless of your ability to pay. And there are, if you are uninsured, there are prescription programs out there that you can utilize that can get you your medication at no cost or definitely a lower cost. So
Right.
there is help available.
Yeah, and the community health centers, they use a sliding scale for charges,
Yes.
right? Yeah.
Yep. It's based on your income.
Yeah.
And
So,
and and I just want to reinforce the fact that they will see you regardless of your ability to pay.
right, good
If you can't
point.
pay that day, they'll still see you.
One question. So, since the enhanced premium tax credits expired at the end of 2025, many people, like you said, could not afford the double plus sum of their premium, and so they didn't elect to continue health coverage under in the marketplace. If those enhanced premium tax credits, which lower your monthly premium for your insurance, um, if they are reinstated, will there be a special enrollment period for people who could hop back on?
We've not heard anything about that, but actually, Susan, I was thinking about that this weekend. That's pretty much the only way I could see this working, right? Like you have to have another opportunity for people to re-enroll, either to enroll for the first time after open enrollment, or to change their plan. Maybe they went with, a lower cost plan that has higher deductibles and co-insurance because they didn't want to be uninsured.
Right. Well, we'll just have to stay tuned to see what the government decides to do about the reinstating the enhanced premium tax credits. So, and just, explain to us how that works and what do those words mean? Sometimes those of us who speak insurance can say stuff that the general public may be confused about. So how does that work?
So I'll start from the top. The An APTC is an advanced premium tax credit, and it doesn't come from your tax return, but it can affect your tax return. So it's really important when you enroll into a plan on Marketplace that you do your very best to guesstimate what your income is going to be for the upcoming year based on your income from the previous year. So if you choose too much of a credit that you weren't eligible for because maybe your income went up and you didn't make that adjustment in your account on Marketplace, then you may have to pay some of that back. Or if you choose not to use any of your APTC, it could increase. You'll get that money in return when you go to file your taxes. If you enroll on in a plan on Marketplace, it's very important that you do file taxes. You have to file taxes to reconciliate your APTC. Back during COVID, the Biden administration enhanced those. So it made it easier for people to get insurance during the public health emergency. That's, having insurance is vital to Americans. So, and those expired at the end of last year. So it's really important that, I without going too deep down, it's really important that the Senate continues to pass this resolution. My understanding is that they'll probably go for 2 years, where the House asks for a 3-year extension. About copays, deductibles, co-insurance, you have your premium that you pay every month. Your deductible is the amount for that you have to pay before your insurance kicks in. And that's usually going to encompass things like any type of medical procedure that you have, surgery, anything like that. Your copays are usually fall under like prescriptions, your doctor visit. The insurance pays everything but your percentage of whatever that copay is. What did I skip one? I just want to make sure I got them all. Copays, deductibles, premiums. I think that's everything I mentioned.
Yes, absolutely. So that describes the structure of the marketplace plans. And, probably people who have employer group plans, it describes the
Yeah,
structure of that as well, quite frankly, Medicare and other insurance products that you can get along with your Medicare. So, yeah, thanks for that explanation. Sometimes
sure.
those words can be confusing. So we have premium tax credits, advanced premium tax credits that don't have to be advanced. You can get them to help you offset costs for your monthly payment to have the insurance, or you can wait till the end of the year and receive those tax credits on your tax return.
Yeah. And then moving on to the health Medicaid and the Healthy Indiana plan. There's been a lot going on with Medicaid since the passing of the big beautiful bill. Some of the changes, and the changes really truly only affect the Healthy Indiana plan. That's going to be our expansion population. Again, many times this encompasses adults who have an entry level position on a lower end of the scale, but still over that income. Um, all Medicaid is required to do redetermination once a year, and that's where the state sends you notification about, to check your income, your residency, who is in your household. Um, with the big beautiful bill, that law now requires states to do a redetermination once every 6 months. Here in Indiana, we decided to go in a little bit deeper, and we are now doing them 4 times a year. So it's really important that you open up your mail from FSSA, and if you're not sure where to go, because many times it can be very complicated, you would want to reach out to a navigator. A navigator can become your authorized representative and help you with your case and work through all those legalities. Another thing that they've added to the Healthy Indiana portion, that expansion population, is work requirements. You are now required to do 80 hours worth of work a month or volunteer. That is not into place yet, but if one thing that I do want to make sure that a lot of people are not aware of, that you know this, that if you do not comply with the work requirements or the volunteer requirements and you are disenrolled through Medicaid, you will not be eligible for APTCs under the Marketplace. So you want to make sure that you are doing the work requirements, or make sure you're reporting them, or you're volunteer. That's a little bit down the road. I don't have the effective date. I think that's next year. Off the top of my head, there's so many different effective dates. So just want to make sure that people are aware that you have to be in compliance, or it could affect your eligibility for another program. And
Right.
if you're asking me, Jenny, you keep talking about these people, where can I go to find these people? You to find a navigator, and majority of your navigators are also certified application counselors. And we're working on more SHIP counselors, right, to increase that accessibility. You can find a navigator on the Indiana Department of Insurance website, IDY. Located under the tab called Navigators, and it'll pop up a menu, and you'll want to choose find a navigator or find an application organization. And oftentimes those people are housed within community health centers, but you can also find navigators at health departments, hospitals, some of your community based organizations oftentimes have volunteers that will help with that process.
And we're thrilled that so many of the Indiana navigators and certified application counselors, like you said, have that third certification as a SHIP counselor. So when you're aging into Medicare, or when you're retiring from your job and you need Medicare information, they can just keep with the same person, and regardless of the type of insurance. I think there's a question. Megan has her hand raised.
Yes, there is a question in the chat box. I went ahead and answered it since it was mainly regarding MSP, Medicare Savings Program, but I did want to share it with everyone. And Jenny, if you want to expand on it, you can, or Susan. Dan asks if there are any changes to QMB income guidelines in Indiana for 2026, or will it still be expanded to meet 2025 income requirements? And I let him know that the Medicare Savings Program income and resource guidelines do generally change annually, but they don't change in January, and it throws everyone off. They'll probably be announced sometime in February or March, and they usually go into effect in March, maybe even April, but I think it's March. Anything to expand on that?
Yeah,
No.
the costs for the or the income guidelines for the any kind of Medicaid programs are based on the federal poverty level, the FPL. And like Megan said, they're usually announced in February and they're effective March 1st. So if you are a person who looks at those guidelines and thinks, oh man, I'm just so close, but just a smidgy over, then hang tough until February when they're announced, and it's possible you may apply. You can also reach out to SHIP, and we can connect you with a counselor, and they can walk you through the very, very easy application and help you fill it out. And then you can just wait, or they can wait to hold it to submit it if you're super, super close, because there is that cutoff. And if you're a dollar over, then you're a dollar over and you don't qualify. And that's tough. We don't know how much it's going to increase, but currently one of the Medicare savings program income is $2,433 for a single person per month. Gross income, $2,433, and we are guesstimating $2,500. It could be more than that. It could be a little bit less, but we will wait and see. We won't know before everybody else will. And then they'll
No,
adjust Medicaid guidelines, right, Jenny?
yeah, I was going to say those are updated effective March 1st. And you can find that information on FSS, how many S's? FSSA's website. And that website is very large. So if you just do a search within the bar, it'll bring up the income for all of the Medicaid programs.
Right. Do you know off the top of your head what the income limit is for the Healthy Indiana plan? We know there's no asset limit, but do you know for a single household? Do you know that off the top of your head? I'm sorry, I'm putting you on the.
No, actually, I already Googled it. So it's 133% of, I mean, I know this, 133%
Of poverty. You're breaking up, Jenny.
Yes, that's what I meant. I'm sorry. Oh, I'm sorry.
That's
Can
okay.
you hear me okay?
Now we can, yes.
Okay, sorry. Of the federal poverty level. So for a household of one, it's just over $1,300 for the minimum, and then $1,800 for just over $1,800 for the maximum. And that could affect your level of coverage, whether it's basic or plus, and then I mean, there's so many different levels of the Healthy Indiana plan. You have state, you have basic, you have plus, and all those, many times those are determined by diagnosis and things like that.
Oh, okay. I wasn't aware of that. All right. I think the key here is that if you need help with health insurance and you're on Medicare, then SHIP is your go-to. If you are not receiving Medicare and you want to know your insurance options from a governmental source, whether it's Medicaid or whether it's the healthcare marketplace, the navigators and certified application counselors are the place to go.
Absolutely. And again, you can find that navigator on IDY's website and that CAC on the healthcare.gov, or if you forget everything, you can just go to our website, indianapca.org, and you can find those individuals, all three certifications on our website as well.
Yeah, that's terrific. Megan, are there any more questions or comments?
Let me check.
Okay. Folks, if you're watching this live, you can ask a question in our chat and we will answer it right now. If you're watching this as a recording, still write in your questions because we monitor this that's posted on our Facebook page for 30 days and then later posted on our YouTube channel, and we still will answer your questions. And Megan can put in the chat how you reach Indiana SHIP, and she can reiterate give us your website again, Jenny. PCA.org.
IndianaPCA.org. I can drop that in the chat if you'd like.
I got it.
Thank you.
And there are no questions currently in the chat box, Susan.
And later on, if you're like, I don't remember what she said, oftentimes when I'm watching, people have a discussion, I'm like, what was that? If you forget everything that I've said and you're like, how do I get a hold of Jenny? Again, you can go to our website and you can click on my profile, and it will send an inquiry to me, and I will be more than happy to help you find someone in your community. I think that's really important to find someone in your community if possible, because those individuals know your community and understand some of the barriers that your community may put on you, right? Like if transportation is an issue, um, if you're experiencing food insecurity, housing issues, like we can help get you to the people that know your community and can help you find those resources that you need.
Right. Terrific. I think we sing the same tune.
It's
PCA
a
and
great it's a
Indiana
great
SHIP.
song. I love it. Yep.
Well, Megan, do you want to wrap us up here?
I do. Let me. All right. So I'm not going to pull up the graphics, so we're going to test my memory. But we will be back, Susan and I, on this Wednesday, the 14th at 10 o'clock a.m. Eastern, to talk about all the different Medicare enrollment periods. We're going to talk about when you can enroll when you're new to Medicare. If you never enrolled in Medicare, the general enrollment, special enrollments, if you qualify due to moving or being on Medicaid or going into the nursing home or losing your Medicare plan, to be able to get a plan that will work for you. We're going to talk about the fall open enrollment, the Advantage Plan open enrollment. You're going to be sick of hearing me talk about enrollment periods come Wednesday. But it is a very, very important one to watch, because there is a myth out there that you can enroll in Medicare any day that you want. And that's not the case. So it's very important that you know when and how you can make changes to your plans. And then I believe we will be back then, I'm looking at my calendar here, on the 26th of January. And we are going to have Barb Miller with us to talk about fraud. And if you have never seen Barb speak, you want to mark your calendars. Barb is wonderful. She should be a comedian. She cracks me up. I just love her to death. But she's going to be here educating us on fraud and making us laugh on January the 26th. I will have the February calendar for our lives out on Facebook soon, but I do want to highlight our Lunch and Learns that we started in January, last Thursday. We will be back in February on the 12th at noon to talk more about Medicare while you're preparing your Medicare years. And then in March, we have our New to Medicare webinar on the 18th or 19th. The 19th at 6 p.m. And you can register for that on Eventbrite. And we do have an event in Facebook where you can click on that Eventbrite link and go register for that webinar. So thank you all for joining us this morning. Thank you, Jenny, for educating us on Marketplace and Medicaid. And we will see you all later.
Thanks.